A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, Lisa. Thank you so much for joining me today. It's lovely to see you. How are you today?
I'm very good, thank you. And I hope you're well.
Lisa, you've been using homeopathy for over 30 years, but I understand you trained in Stroud. Tell me a little bit about that.
The Stroud School of Homeopathy was a revelation to me. I met kindred spirits. I learned the philosophy of a fascinating art and science, and I so appreciated the tuition that they gave me. Moreover, it's in a beautiful setting in the sort of rolling hills of Cheltenham, and it was just a delight to go to Hawkwood College where it's set. It looks like a kind of something out of Harry Potter, and enjoy the conviviality. It was a fabulous experience, and I keep in touch with several colleagues that I met there.
Oh, that's fantastic. That's fantastic. So why were you using homeopathy before? What started you on the homeopathic journey?
I lived in the tropics with my family. I had 2 young children, and I would take them to the doctor because they had an ear, nose, throat complaint, and the doctor would prescribe antibiotics. And okay, I'm not going to say that the antibiotics didn't work. Of course they did, but the children responded to the antibiotics. I mean, there were side effects. They were dulled down. They were constipated. They were thick. I don't know how else to explain it. And although whatever the nasal congestion, allergic rhinitis problem with the ear, nose, throat did resolve, it resolved at a cost. And I thought there's got to be something better. And of course, in the tropics, things breed. It's hot. And I think the reason for the antibiotics, I can't fault the doctors. They know that they need to nip these things in the bud because things do tend to breed and breed quickly and ferment. And so I do understand their approach, but I thought there's got to be a better way. And when I learned that homeopathy was a possible solution and also complementary to conventional medicine, I thought I've got to go down this route. And so I did. My daughter had night terrors, and there wasn't a conventional medicine that could touch it. But when I went to a homeopath, the homeopath was able to find something that was a solution and stop them, and kind of helped her to feel more steady somehow. And that was marvelous.
Okay, so it's amazing. It always surprises me that, and probably you too, that homeopathy can actually touch things that there's nothing that can help in conventional medicine. So what was it that made you actually decide, okay, this is great, I want to be a homeopath?
Yeah, there's one thing to use it, but another thing to become a homeopath. When I saw the effect of homeopathy on my children rather than on the antibiotics that they've been using, I saw that they had no side effects, that they sprung back more quickly, that they didn't end up getting congested or blocked in terms of their bowels. And I thought, this feels light. This feels effervescent. This feels natural. And of course, I'd been reading a little bit about it, and I bought Andrew Lockheed's book, The Family Guide to Homeopathy, and started practicing with my family, just gently, because I didn't really know what I was doing back then. And the more I used that text, that guide, the more I was convinced that I had found a natural, holistic, and very individual answer to problems. And then we left Hong Kong and we moved to London, and Andrew Lockie was practicing in Guildford, and he became our family homeopath. I am so blessed. So we actually had that benefit, and that totally reinforced my conviction that this was the way forward. My reason for then studying it was that I'd already been practicing it for many years, had found its efficacy, and was intrigued by everything from how it worked to why it worked to how it could complement conventional medicine and ultimately, in my opinion, override conventional medicine as a solution to many health crises, and also to ongoing problems with out of tunement, with sort of dis-ease. In other words, people come because they're stuck.
Yes.
They're stuck in an emotional, in a mental way, never mind that they've got physical manifestations. And I saw that the homeopathy worked on that just by practicing with family and friends. And that convinced me that I should give it a try. So I did. And at first I studied, what's it called? It was an online sort of course. It was a correspondence course. Yes. And then I went for weekends to Stroud, and that was fabulous.
Oh, amazing. Okay. So I'll add the Andrew Lockie book to our book list on the website, because that's a lovely book for people to start. And I guess then it's full circle for you, because now you're involved with Homeopathy 24/7 and you're helping other mums learn about self-prescribing. That
has been fabulous. I have a local practice. Thank you, COVID. The local practice, it didn't dry up exactly, but people were afraid. People were afraid to come to my house. People were afraid to meet in public. And so we did have Zoom conferences, but it just, because they had been my patients face to face, and because they were so nervous about what was going on, things weren't really, I wasn't getting any more patients. Nothing was happening. And then I discovered Homeopathy 24/7, and I thought, this could be a solution. I actually found it through my tutor at the Stroud School, Karen Ledbetter, who has been a marvelous supervisor for me, but also mentioned Sophie, who is the website designer, because Sophie helped Karen with her website. So anyway, so I, for me, going to Stroud was a sort of the destination I was always headed for.
Brilliant, brilliant. Yes, it's funny, isn't it? It's small things. So Sophie helps us with the Homeopathy 24/7 website and lots of online things that we're putting together for mums using homeopathy as well. So there's the link there. So brilliant. So tell us a little bit about, well, have you got any case studies that you would like to share with our audience today?
I do. Let me backtrack 1 minute to say that what I've benefited from with the H247, Homeopathy 247, has been two things. One, that it has allowed me to help people who come online and say, I've got a small acute problem here, as well as to help them when they book an acute through the platform that we have. So I've been able to help them both by typing answers to small problems, as well as treating acute problems that rise on a video call. But secondly, Homeopathy 247 has provided me with a marvelous community of support and of friends. And I've been to London to visit them several times. I've also made marvelous virtual friends all over the world. And finally, it's allowed me to reach out all over the world to potential patients and to people who need help. And I've never looked back. It was a very good decision. Now, as far as case studies are concerned, there are two I would like to share. And the first one is a very assertive healthcare. She ran a healthcare center, and she was. She came to me because she was constantly getting recurrent tonsillitis. She had been to the doctor so many times, and the doctor had always given her something that helped, But then the tonsillitis would come back again. She had young children, and of course she had the healthcare center, and she couldn't afford to constantly have to take off work with this tonsillitis. And so we had a meeting in the healthcare center because she wasn't, she was so busy. She could only allocate an hour and a half to our discussion together. And what she told me fascinated me. She was like no one I'd met before. She said, I feel stuck on earth. I feel tethered. And yet there's another side of me that can see into the future, that can actually communicate with the dead. And I thought, this is a most unusual woman. And she said, I've had this propensity to be able to look at people and see their past and their future all my life. And I've also always had dreams about flying. And I feel that this is my calling somehow. I mean, she was speaking that marvelous language that isn't quite sort of non-human, very specific language that is saying, here's a remedy. And so I started looking at possible remedies for her, and I found something unique and refined and specific that matched her symptoms, the clairvoyancy and the feeling of stuckness on earth, as well as the recurrent problems with the throat, perfectly, prescribed it for her. And she then went on a month-long sojourn to her home country, where she was providing seminars and seeing her family. And she said she had the most marvelous sense of well-being. The tonsillitis never came back during the whole time she was away. She felt freed somehow. And I was excited because it was one of my earlier cases, and also a most unusual one. And I realized that homeopathy can offer something quite specific, quite individual, quite tailor-made to that person. Whereas conventional medicine, somehow I feel I'm taking a hammer and hammering a pin. It's very clumsy. It doesn't, of course it can solve the problem, because it's broad spectrum. You're often prescribed a broad spectrum antibiotic, but it doesn't get to the root cause. It doesn't get to the to what's underneath and creating the misattunement in the patient. And therefore the disease comes back. Worse than that, conventional medicine can suppress the malady, and therefore it will raise its head in another much more serious way ultimately.
It's amazing that you said in the first instance you had to go to her clinic. She could only fit you in for an hour and a half. She was very, very tied up with everything. But then after the remedy, she could go off for a month and completely change her aspect to work and life.
Well, that month was partly work as well. She was giving talks, so she could justify it, but yes. Okay, amazing.
Brilliant. So the fact that homeopathy, really, we go back, we look at every aspect, not only the symptoms, but also what's happening, how you are, how you respond to the world, but also then afterwards, how it can be life-changing.
My second case demonstrates that. This was a young girl who desperately wanted to be a masseuse. She had no confidence in her academic abilities, and she was working as a sort of a PA in an office, and she felt like a dog's body. She was denigrated by her boss. She felt unworthy. She was given she was always asked to stay after. They really took advantage of her, and they were not nice about it. And so she felt hard done by. When we met on our first consultation, she would not look at me. She could not look at me because she had no sense of self-esteem. So the entire interview was conducted like this. And I found that very tricky. And I thought, what's going on here? Does she not like me? And I realized that it was to do with her not liking herself, not feeling confident enough to be the recipient of my attention, and It turned out through this interview that I learned that through her childhood, she had been verbally abused and unappreciated by her mother and her family, and that she had never felt worthy, that her early life was one of feeling that she didn't belong, that she wasn't good enough, that she was not worthy. And so when I asked her, what's the problem now? She said, I can't concentrate. I study and it goes in one ear and it goes out the other. I forget everything. And there's no way that I can possibly pass this test to become a masseuse. So I looked into a possible remedy for her, found what I felt suited her childhood problem, her mental and emotional feeling of unworthiness, as well as this problem of being forgetful. And I found a remedy that I felt was very well indicated, prescribed it for her, and she passed the test as a masseuse in May, and was so confident of her ability that 3 months later she ended up studying something to complement her masseuse treatments, craniosacral therapy, and felt confident to do more studying because she wasn't forgetting, she was retaining. Moreover, she asserted herself at work and ultimately found a new job within the organization, not with the woman who had basically not made her feel appreciated. And so she changed her job. She changed she embarked on a career and supplemented the career with something else. When she went home to see her parents, she was assertive and calm and confident in a way that they didn't like. They wanted to put her in the old box.
Yes.
But she was able, through working with herself and with the remedy, because I'm not saying it stopped after the one, we worked together for a long time, to assert herself. She felt more confident as a member of her family, and also found a boyfriend who wasn't rude to her and didn't mistreat her the way she was repeating the past in essence. And so for me, this is an example of how homeopathy can change your life, really, can change the way you see yourself, the way you think, and the way you go forward. And I feel that it gave her a foundation, a foundation that will be with her for the rest of her life. Which is
amazing. Brilliant story. And we often find, don't we, that people have sort of spiral lives. They have instances that are recurring through their lives. They're kind of on a journey that repeats, and homeopathy can break them, take them off that track and put them on a different track.
Yeah, we tend to choose what we know. And so if you've been in a relationship with your father, which was abusive, then you choose an abusive husband, or, in her case, an abusive boyfriend, because she wasn't appreciated in her family. And we do tend to cycle back. And it's because we know that we're comfortable there. We're afraid to break out. We don't realize any of this, of course, but the beauty of homeopathy is that it works by triggering the vital force to spark the body to heal itself. And it heals itself on 3 planes: mental, emotional, and physical.
Okay. And you mentioned there that she came to you because of her lack of concentration to pass her exam. But then she passed her exam, but she stayed with you. And we often find, don't we, that our clients realize, okay, they come for one thing, but they realize that there's so much more they can be doing to find themselves.
Yes, I feel that that's the byproduct of having found a good remedy, first of all, and having therefore established a trust in homeopathy, as well as between me as the practitioner and my client. And yes, they do come back, and they come back with something much more serious. And that's been fabulously rewarding for me.
Lisa, tell us a little bit about your digestive group. You've got a Facebook group, Homeopathy for Gut Health. Tell me a little bit about that.
I was a bit wary about that because I didn't want to specialize. I thought, well, wait a minute, I'm treating patients with skin disorders, with forgetfulness, with chronic tonsillitis. I don't want to shoehorn myself to become a practitioner in tums and bums, shall we say. The digestive tract goes from up here all the way down to the anus. And yet this was part of the requirement of being a homeopath in Homeopathy 247. So I swallowed hard and decided that I would suggest this. Nobody in my year group was focused on this. And I thought, well, let me do something different that I know something about. I had recently watched Hilary Dorian, who is a marvelous homeopath, discuss digestive disorders. And so I felt I had a foot in that camp anyway. And I was fascinated by how debilitating and crippling stomach problems are, how you really cannot get on, how they stop you in every sense, both physically and mentally, not to mention make you an emotional wreck. And so I suggested this, and then found that there were other homeopaths in the Homeopathy 247 group interested in joining me. We now have a group of 5, and we have launched a Facebook. When I say we have a group of 5, these are the administrators. We have members in our Facebook group of over 600 people after only being on the site since really the end of March. So I'm really excited by that. Yeah. And I'm beginning to see a marvelous rapport build up between the group of administrators, my colleagues, and me, and the potential patients who are coming to us with problems of IBS, diverticulitis, GERD, as it's called, what is it? Acid reflux and reflux and heartburn. And I've also managed to build from our group relations, networks, connections with diverticulitis UK, gastrointestinal problems, Facebook groups. So we're feeding into other groups and benefiting from that reciprocity. So that's been great. The rapport has been great. The fact that the group is growing so fast has been great. And finally, I'm learning things that I didn't know about the specifics of some of these digestive disorders and becoming a better homeopath to boot.
Yes. There's so much that we can learn, isn't there, as we go on. The homeopathy, we often say, is all about learning, because once you begin on this journey, you never stop learning. But it's so brilliant when you can actually bring lots of cases together in one area. And our next stage of Homeopathy 24/7 is actually to start reporting our results, working with people as well, because of course this is what the world needs right now. It needs more homeopathic positive results, so that we have got everything that we need to take homeopathy further around the world.
I don't know how my colleagues feel about this, but I certainly don't like tooting my horn. So I find that when a patient says, I feel so much better, I don't generally say, oh, could I use that and put it onto my website, or can I, and I really ought to. For me, the satisfaction comes in that I've helped somebody who's not well. I mean, that is my ultimate goal. I feel, it's something that I learned from the school. They have a marvelous torch that they give us, a pin, a torch pin, which is a golden colored pin, which the idea behind it is that it will radiate light and health. And I feel that that's my job as a homeopath, that I'm here to try and radiate my knowledge, to radiate my experience and practice and theory, my learning, to patients who need help, and make them, to illuminate them in a very subtle way by sparking their vital force to heal.
It's so brilliant how, by taking homeopathy online onto social media, by building groups, by being available for people, that we're giving people, so many more people, the homeopathic choice in medicine.
Yeah. And I think choice is the key word, because they think, oh, well, I'm sick, I need to go to the conventional doctor. And the conventional doctor can help them. There's no doubt about that. But why does it come back? Why does so much come back? Or worse than that, something else goes wrong.
Yes.
And this is where homeopathy can be much more precise, much more specific. So I think it works alongside, and it offers a choice that is natural, holistic, and tailor-made.
Brilliant, brilliant. Thank you so much for joining me today, Lisa. It's been great just being able to talk about homeopathy. And I hope everybody that's listening can find somebody to talk about homeopathy with.
Another thing that our platform offers, which I think is marvelous, is the ability to speak without we offer free or complimentary conversations with people who are exploring, not sure what is it, how can you help me, here's what's wrong, and then just through a short chat we can illuminate them, tell them, okay, this is what we can do for you. I can see that the problem is such and such, and then they can come back and book an acute consultation, and we can recommend a remedy that will put them on the path to better health.
Yes, that's right. And of course, we are here to help everybody learning about using homeopathy at home as well. How, just as you did for 30 years before deciding to become a homeopath. So it's a brilliant journey.
Thank you very much for this opportunity, and all the best.
Speak to you soon. Thank you so much, Lisa, for joining us this week. It's been really fascinating just talking to you about the depth of homeopathy, about how homeopathy can go so much further than we ever expect it, about when clients come to us and want help with a particular thing, a particular symptom, they then realize that actually it can go so much more, and so much more can be had out of just exploring your health and background to health. Next week, we will be welcoming Dr. Shrikant Talari to our podcast. He is going to be talking to us about supporting people with homeopathy with a cancer diagnosis. So we're going to be asking some difficult questions. We're going to be really exploring what homeopathy can do and how it can be useful in these circumstances. I look forward to seeing you then.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.